This technique's good for pain coming below the kneecap, so things like Osgood-Schlatters disease, Patellar Tendinopathy, Patellar Bursitis, Patellar femoral pain syndrome, anything where you're feeling the pain in the kneecap just slightly below. Okay, so for this we're going to use three pieces of tape. The first piece we sort of measure so it roughly covers just over the size of your kneecap, and where we're going to place it is we're going to flex the knee, and then we're going to find the kneecap, and then as we come down we'll find a bony prominence called the tibial tuberosity. The tape's going to run between the kneecap and the tibial tuberosity. Okay, so just if you find the kneecap and just put your fingers down, it's just that region there. So our first piece of tape, we've rounded the edges again, so once you've cut it, just round it off, it'll make the tape last a bit longer. And this, what we're going to do is we're going to break the backing down the centre. Okay, once we've broken the backing, we'll pull apart, and then we can lift, he says, we can lift the backing off. And what we're going to do is we're going to apply a 75 to 100% stretch on this tape and lay it straight across that region between the kneecap and the tibial tuberosity. So that's laid with stretch on, and then we just smooth off at the end with no stretch. Like so. And taking the backing, taking the printed side, just rub it down to activate the glue. Okay. Our next two strips, I mean, the measurements, what I tend to do is you come from that bony prominence across, it's about a hand's breadth. You're finishing about a hand's breadth above the knee. Okay, so this one, we're going to take about the first inch, take it off, being careful not to touch the glue, and then we're going to lay it mid-thigh above the knee and place it down with no stretch. Now keeping our fingers on the tape, we're going to pull the backing to break it and lift it off, so we're holding the last inch or so. For the first part we're going to apply about 25% stretch, and as we come to the outside of the knee we're going to go to 50% and then ease off completely with no stretch at all at the end. And what we're doing is we're trying to come round and hug, so the tape's just hugging the kneecap. Okay. Second piece, same length, tear off about an inch, take off the backing, lay it next to your other piece, pull the back in, lift it off. Again, 25% to begin with, 50 as we come round the outside of the knee, and then ease off with no stretch at all at the end. And then rub it down again. And then what you're left with, camera, is the taping, which looks a bit like this. Then as we bend the knee, you can see the lifting of the skin. That's the effect we're going for.